We once again find ourselves under a new range of restrictions on our movement and way of life. This follows last week's declaration by the Health Minister, Dr. Zweli Mkhize, that we're now officially in a second wave of the COVID-19 pandemic. On Wednesday, we breached the 10,000 mark for new infections for the second time since March. The Council for Scientific and Industrial Research, the CSIR, has been tracking and analysing the coronavirus rate of infections in the country. We're joined now by Dr. Ridwan Suleiman, a senior researcher at the CSIR, for some perspective on this. Dr. Suleiman, good afternoon to you. I appreciate you speaking to us this Friday afternoon. It seems, I think to me, and I think to almost everyone, the second wave, the number of new cases is going up very quickly, far more quickly than it did earlier in the year.
Good afternoon, Stephen. Yes, indeed, it's rising exponentially and rising really rapidly. In all likelihood, we'll pass the 900,000 mark of cumulative confirmed COVID-19 cases later this evening, and that last 100,000 cases coming in just the last 15 days. So it's a very rapid rise in cases. And it's not just cases. Cases are a leading factor, but we can look at other measures and things like the test positivity, hospitalizations, deaths. They're all following very similar trends.
Why is it moving so quickly? And I realize it is sort of, I mean, arithmetic is when something goes up by 1 + 1 + 1 + 1, but exponential is when, you know, it sort of squares itself. Why is it going up exponentially? Is that because of the way that people are moving around?
It's difficult to know. To be honest, I don't know the exact answer. There could be a number of factors. One of the things, just from a data-centric point of view, if you look at the graph that you just put up now, we're starting from a higher base in the second wave as compared to the first wave. For a number of months, as we passed the first wave, we were seeing on average about 1,500 to 2,000 cases a day. And that's a higher base. We never really went down to zero. So I think that could be a factor. We're also now seeing that the infection is spreading into the populous provinces of starting from Eastern Cape, moving into the Western Cape, KwaZulu-Natal and Gauteng. And these are the four most populous provinces. And so we're seeing that the numbers are rising there. It could also be due to the fact that in the first wave, we had some restrictions. We were in level 3 during the peak of the first wave, whereas the restrictions are lessened at this time. So there could be a number of factors contributing to this.
The other thing, of course, is that, if I've understood it correctly, we're doing a lot more testing now, aren't we?
Well, we have increased the testing week on week. In the past week, the tests have increased by about 25% to an average of 40,000 tests per day. However, that isn't quite where we were at during the first peak. We were testing close to 50,000 per day at the peak of the virus in July. So while the testing has increased due to a larger demand for testing, more people just requiring tests, and also the inclusion of the antigen tests, this isn't quite the reason for the increase in cases. It's a factor, but if you look at the number of tests that are returning positive results, or the test positivity, this is increasing as well. So the increase in cases is real, and it's not just a factor of an increase in tests. And we can qualify that by looking at the test positivity.
I mean, there's so many different sort of factors to take into account. I would suggest the one thing that might have changed from the first wave, and obviously it'll depend, but the number of people who die as a result of the disease, or the percentage of people who contract the disease and then die from it, might also be changing, because we've seen that people who are admitted to intensive care units with severe symptoms of the disease, they now have a better survival rate. In other words, the treatment has improved. That's quite important, because in the end, what we want to do as a population is to make sure people survive and get healthy again. I mean, that's the end goal of this, isn't it?
Absolutely. I believe that treatment methods have improved. We're also learning more as more time goes by. And as you say, ultimately, we want to save lives. And measures that we put in place should just ensure that people get the best access to healthcare facilities, that we don't overwhelm these facilities and place additional or just too big a burden on the healthcare workers. Ultimately, we just want to give people the best access to the healthcare facilities and save the most lives as possible.
Now, I mean, it's fascinating to watch the way this virus moves, because it's obvious that, you know, the more people there are in a place, and the more densely populated they are, and the closer they live together, the more likely it is that this virus is going to move around. There's an economic aspect to people who can get tested as well. So it makes complete sense to me that the Eastern Cape, Western Cape, Gauteng and KwaZulu-Natal again are the hotspots, as they were in the first wave. And we remember how the Western Cape went up, then the Eastern Cape, then Gauteng and KwaZulu-Natal. I'm fascinated by the fact that Limpopo and the Northern Cape, I mean, obviously they've got smaller populations and perhaps a lesser population density, but they still have very few cases. I mean, very few cases.
Well, I think you have to take into account the population size in those provinces. So it is quite correct. They have fewer cases, but Limpopo and the Northern Cape sort of went into their first peak later than all of the other provinces. And if we look, even if we track the incidence rate, Northern Cape and Limpopo, they did increase, not quite as high as the other provinces, but if you scale it by the population size, they certainly did increase. I think we just don't see that because the absolute numbers are not as high as what we see in the big provinces, Gauteng, Western Cape, etc.
I mean, if we look at the numbers that we're looking at now and we see how quickly things have moved, you know, one week it was 3,000 new cases a day. Suddenly the next week it was 8,000, then it was 10,000 this week. It's moving more quickly. The number of new cases is going up more quickly than it did in the first wave. And the first wave peaked at roughly 15,000 new cases a day. That was July. It was expected, and then it started to go down really quite quickly. Do you ever expect it to go down?
Well, we hope it will go down. We hope sooner rather than later. As you say, in the last week, we're seeing on average 8,000 new cases per day reported across South Africa. And that's an increase of almost 60% compared to the previous week. So a very rapid rise. And this rise is currently in Eastern Cape, Western Cape currently, as you see by the incidence rate in this graph here, currently surpassed the level that it saw in the first wave, and also higher than that seen by any of the other provinces. So that is quite concerning. So here we can see an incidence rate of 38 infections per 100,000 people currently in Western Cape. KwaZulu-Natal and Gauteng also rising quite rapidly. The good news, though, is that the Eastern Cape is starting to show a slight slowdown of that increase. So while it's still increasing, it's not quite increasing as the same rate as a few weeks ago. So over the last week, the increase in cases in the Eastern Cape has been about 10%. So there is hope that hopefully that is slowing down, and the other provinces will slow down as well once they hit their peak too. Concerning the hospitalization numbers are still increasing, specifically in those big four provinces, and the death numbers are also starting to show an increase. As shown by the graph you've put up now in the Eastern Cape, the average daily reported deaths are currently 45 deaths a day, which is just as much or just as high as what was seen in the first wave. Similarly, in the Western Cape, the number of reported deaths are also increasing. In the Western Cape, the daily number of deaths reported there is 45. Sorry, in the Eastern Cape, it's 95 a day. In the Western Cape, 45, compared to the highest point in the first peak, which was just over 50. So a significant number of deaths now being reported. And the deaths are a lagging indicator. And so they will lag the cases by a few weeks, but these numbers are starting to pick up also quite rapidly. And also, as you can see from the hospitalizations, they are increasing. The Eastern Cape and the Western Cape number of new admissions have surpassed that's been seen in the first wave. KwaZulu-Natal hospitalizations increasing quite fast, and similarly Gauteng now picking up too.
I mean, if you look at all of these numbers, the argument will start to build for another lockdown. People are going to be moving around more now than they were in the first place. Obviously everyone relies on face masks and all of that, and there are furious arguments around beaches. But it would seem almost inevitable that the number of new cases a day is just going to climb and climb for the next little while.
Indeed, it will continue to rise for the next few weeks, and we need to brace ourselves for that, particularly as it moves to these big provinces. We're just starting to see the rises in KwaZulu-Natal and Gauteng, and Western Cape is still on the rise. So we need to brace ourselves for these increases. I don't think we should be speaking of lockdown nationally at the moment. I do think there are a lot of implications to going down that route, and we saw that in the first wave. I think as we've seen over the last few weeks, this differentiated approach and preventative measures at a district level or focusing on hotspots could be the way to go for now. And then perhaps also focusing on trying to limit the conditions to prevent these super spreading events and these cluster outbreaks. I think that needs to remain a focus. We need to focus on avoiding crowded places, closed spaces, in particular indoors where the ventilation is poor. So we need to focus on the ventilation issue and make sure that we rather go in places that have good ventilation, and then have this cluster busting approach essentially to prevent the super spreading events, and hopefully that will see us through.
Dr. Ridwan Suleiman, I really do appreciate the time. Thank you. Senior Researcher at the CSIR. All right, plenty coming up in the next little while. We will look at more efforts to ensure the faster distribution of COVID-19 vaccines around the world. Stay with us.